Today I'm going to talk about dengue fever. Dengue fever, like Zika virus, like yellow fever, like chikungunya, is spread by a specific type of mosquito called the Aedes mosquito. This is a disease that for maybe 20% of people, and more so in children, is completely asymptomatic. They get bitten by a mosquito, it passes them the virus, they have no symptoms. But for others, they get fever, chills, muscle aches and pains in their joints, or what we call arthralgias. So much so that sometimes dengue is called breakbone fever. The thing about dengue is that there are 4 different types of dengue. And when you get one, you get immunity to that one strain. But if you get infected with a different strain, that immunity can work against you, and you can get what's called severe dengue, which could lead to hemorrhaging or bleeding. It could lead you to be in shock, and people die from dengue fever when they get this severe form because of this phenomenon of one type of dengue predisposing you to severe disease when you get infected with another type. And this happens through a process called antibody-dependent enhancement, meaning the antibodies that you generate against one strain do not protect you against another strain, but actually make it worse. There is no specific antiviral for dengue, although there are some that are in very advanced development that are likely ready to go if they can find a commercial market, which is the problem when it comes to emerging infectious disease, that many companies don't see a path to return on investment, so many things don't get developed. There are dengue vaccines. One was available in the United States, but it's no longer being marketed. There is one called Dengue that is available throughout the world, and it is seeing some use. But dengue is primarily an issue for travelers from the United States to places like the Caribbean, to parts of Africa, to parts of Asia. We do sometimes get local transmission of dengue in areas like Hawaii, Florida, the Texas-Mexico border. There have even been dengue cases in other parts where this mosquito is present. All that needs to happen is an infected traveler has to get bitten by the right mosquito in their hometown, and then they can start a local outbreak. It doesn't happen that often, but it does happen. So dengue fever is something that you need to think about when you're traveling to areas, and that may involve using mosquito repellents, sleeping under a bed net. Those types of things may be useful if you're in an area where dengue is common.